Cancer Alley is an area in Louisiana which has one of the highest densities of petrochemical facilities in the US. But there's not a lot of information on the concentration of air pollutants in the region.
Cancer Alley is notorious. It has a reputation of having high levels of air pollutants, but we really didn't know exactly what to expect. And what we found was an eye-opener for us.
Without your health, you have nothing. And the industries that have come in, they have significantly reduced our quality of life. These are highly carcinogenic chemicals that are being emitted in Cancer Alley, which is why we shouldn't just have one air monitor for the whole St. James. There should be multiple air monitors, and those should be on the fence line, and it needs to be monitored independently. It shouldn't be the industry monitoring themselves.
With this air monitor, this is the only one in St. James Parish. And public officials don't even try to help to get air monitors. The people that live in these areas ask for the monitors because we feel that the officials are not on our side. They are not helping us.
Given how much pollution there is in the area, we would think that the government would have a lot of monitors around. Instead of that, what we actually have is that the industrial facilities in the region provide estimates to the government of how much of these chemicals come out of their facilities. And then the government takes those estimates and translates them into what they think people breathe. But it's not a real measurement. If you look at the data and compare it to what you hear from advocates for communities, there's a real disconnect in what people are experiencing. And that's why we're here. We're not going to deal with these uncertain models. We're going to take real measurements in the field to understand what people are breathing and what we think it means for their health.
So this is our mobile measurement laboratory. Mobile observatory measuring particles and other pollutants, also known as Mom and Pop for short. And inside, we essentially have a laboratory on wheels.
These instruments are state-of-the-art. They're designed to measure more sensitive concentrations and faster than regulatory instruments are able to do. So we're using these tools in a way that really hasn't been done.
We're driving 8 hours a day, 6 days a week, the same route over and over and over, so we can map out the pollution across this very large area and see where there's pollution hotspots for things like ethylene oxide, or chloroprene, or benzene, which can cause cancer or have other detrimental health impacts. That first few times driving next to some of these facilities and seeing really large plumes, it was shocking. The toxic releases for that area, there's nothing higher.
When we got the actual measurement data and we looked at that in comparison to what the models told us the data should look like, it was stunning. Really, really stunning.
So all of these shapes are census tracts in Cancer Alley, and the color of these shapes is associated with the concentration of ethylene oxide that was observed on average over that month of measurements in February of 2023.
I expected that we might find levels of chemicals that were higher in some cases, but we found pretty much across the board that our measurements were so much higher.
In this case, we were seeing, sometimes 10 to 20 times higher concentrations of pretty toxic chemicals like ethylene oxide. It's very clear that the ethylene oxide data indicates a pretty substantial underreporting.
It's hard to conceive of how we can so dramatically underestimate the risks people are facing. So Pete and I, we were looking at the data and it was just this immediate reaction. We've got to get this out.
Turn left onto Main Street.
The Johns Hopkins report shows what we've been saying all along. And that is that industry is polluting us, and they're killing us.
We don't need another plant here in Ascension Parish or anywhere throughout Cancer Alley. We are full.
We want everybody to care about what happens to Cancer Alley. Because if it's us now, it'll be you later. They'll expand to your neighborhood. And so we should all be in this fight together. It shouldn't just be the people in Cancer Alley that's fighting and pushing back. We should all care about it. This is a human issue.
Cancer Alley is one of the biggest environmental injustices ever to happen in the United States. When you look at the data from our measurements, the cancer risks that we estimated are much, much higher than we'd allow anywhere else in the country under any circumstance. We saw cancer risks that were much higher than what the government would allow at a cleaned up toxic waste site. So we are underestimating people's risks if we rely on government models, period.
I've been telling the world that we are dying. We literally are dying. The lady over there had cancer. The man over there had cancer. My brother had cancer. Oscar died with cancer. And so on and so forth. All down the street we have cancer. They just want us to die so they can take our land and bring more industry in. But as long as we can fight, they will not bring any more in St. James.
People have been demanding change forever, but now we need that change to actually happen. We need to take the data that we've collected and place that alongside what the community wants and push for change.